Hello, everybody. Good morning. Yes, come on up, everyone. Lovely officials with me today. All right. Dr. Carson, come on up. Thank you so much. Good morning and Happy New Year, everybody. It's great to see you. It's great to be with a very packed room. I'm sorry we kept you all very busy over the holiday break. And I know there is a lot of news out there today, both here at home and around the world. I will be happy to take all of your questions on all of that news. But first, I'm really honored to be standing up here today with esteemed members of the President's Cabinet and his health team to make an important announcement with respect to the President's domestic promise to make America healthy again as we kick off the new year. In less than a year in office, the President and his incredible MAHA team have made real progress on this front. Here are just a few of the significant MAHA achievements thus far. More than a dozen food manufacturers and trade associations have made commitments to remove artificial and petroleum-based food dyes from their products. The Trump administration took strong action to bar hospitals from performing dangerous, irreversible, life-altering transgender procedures on children. The Trump administration announced funding awards to states through the Rural Health Transformation Program, an unprecedented $50 billion investment established under President Trump's One Big Beautiful Bill. The Trump administration has also worked with 18 states across the country to ban junk food purchases using SNAP benefits starting this year. And thank you for leading that effort, Secretary Rollins. Additionally, President Trump took historic action to secure most favored nation drug pricing and secured deals with major pharmaceutical companies to massively lower the cost of prescription drugs. And those effects are being implemented as we speak. Americans are going to continue to see the result of these incredible deals the president cut. And I know President Trump and this team behind me worked incredibly hard to lower those drug costs for Americans. On Monday, the CDC adopted common sense updates to America's childhood vaccination schedule based solely on the gold standard of science. This action empowers parents and physicians to make the best individualized decisions to protect our children, while also restoring much needed confidence in our public health system. And as a MAHA mom myself, I'm very grateful for that. So thank you, Secretary Kennedy. To build on this progress, the Trump administration is now updating federal nutrition standards and guidelines to ensure that Americans have the most accurate, data-driven information supported by science and hard facts, not special interests or partisan ideology. President Trump has tasked two of the great individuals behind me, USDA Secretary Rollins and HHS Secretary Kennedy, with collaborating on this vitally important project. And today they are here to officially unveil the 2025 to 2030 Dietary Guidelines for America. These new guidelines are informed by the best and most reliable research on health and nutrition, particularly as it relates to the role of our diets and the prevalence of chronic disease in the country. They are also These guidelines are easy to read and understand, so every American, young and old, can access this information that literally has the power to change lives. But these are not just an updated guideline. These are the foundation to all federal food programs in our country. These new guidelines are going to update the food that is served to America's children in our public schools, to the plates that are served to our great men in uniform in our military, our veterans, and the food that they are consuming at the VA. And these new guidelines are also going to impact nutritional programs for the needy in our country, such as WIC and Head Start. Unfortunately, for decades, federal dollars has promoted low-quality, highly processed foods that lead to scores of long-term health issues, which means Americans have gone broke because of these health issues. Faulty dietary guidelines of the past stacked the deck against healthy eating and food options for everyday American families, which has fueled the chronic disease epidemic and jacked up the healthcare costs of households across the country. This failed approach in our public health system ends today. When these guidelines are followed, Americans will be saving themselves thousands of dollars. If we want to cut healthcare costs in our country, we must become a healthier country. According to the CEA, poor diet is the root cause of obesity, which accounts for $400 billion in medical spending each year. A healthier America will lead to a more affordable America. The new dietary guidelines from the Trump administration will ensure federal dollars go to real food to improve public health and therefore save the American people their hard-earned cash over the course of their lives. So with that, I am going to hand it over to Secretary Kennedy. The great people behind me will give remarks, and then we'll get into Q&A for the officials that are here on this specific topic. They will leave because they're all very busy people, and then I will open it up to Q&A with the rest of you on the rest of the news in the world. So thank you, and we'll start with Secretary Kennedy.
Thank you, Karoline.
Thank you.
Today marks the